Hi, I am Dr. Chandrasekhar, Head of Orthopedics, Chief of Knee Services, Sakra Hospital. I am here to talk to you on meniscus injuries, which are very important injuries in the knee. Knee is made up of thigh bone, leg bone, and kneecap bone. There are two rubber pad C-shaped structures called meniscus. One is called the inner meniscus, one is called the outer meniscus. The basic functions of these menisci are to give the cushioning or the shock absorption of the knee. Whenever these meniscus are torn, which gets torn because of rotatory injuries or sporting or non-sporting injuries, these meniscus gets torn. Once they get torn, the patient comes with a pain and limping to the doctor. Once the examination is done, we do the MRI scan to confirm our diagnosis on the meniscus injuries. This meniscus is divided into three zones: outer zone, mid zone, and inner zone. The tears can extend from outer to mid to inner zone. Depending on the tears, we decide what type of treatment is required for the patient. Smaller tears which are in the outer zone doesn't require surgical intervention, or we can observe over time with physio and rehab, and then we can take a call after 3 or 4 months of repeat MRI and then take a decision if it is not healed. The tears in the mid zone and the inner zone usually doesn't undergo any healing, and they are subjected to some sort of treatment. The bigger tears definitely require surgery because this causes pain, limping, and especially jumping sports or getting down from stair climbing becomes more painful. In patient, we do the MRI and find out the tears are there. Then when the surgery is indicated for such type of patients, there are two types of surgery. One is meniscal repair, one is called meniscal trimming or meniscal balancing. The tears which are inside the knee or the inner zone, we subject the patient to a surgery called meniscal trimming or meniscectomy. And the patients where the tear is in the mid zone and the outer zone, we always try to fix or repair this meniscus. Meniscus are very important and crucial structures in the knee. Once you lose the meniscus, you can't get it back. Unlike the ligament surgeries, where you can take patient's own ligament and do surgeries multiple times, meniscus doesn't have any inherent capacity to heal by itself. So always try to preserve as much meniscus as possible. In my practice, I do very stringent measures to know whether this should be repaired or not, meniscus, and I do a lot of repairs every year. Once we do the repairs, it's a daycare procedure in the hospital. Patient go home next day. They start moving the knee immediately the next day after the surgery, and they also start walking with a walker. They won't put the weight on the operated limb for 4 to 6 weeks depending on the type of tear. Once the healing of the meniscus occurs, over 4th or 5th month, we subject the patients to sports agility balance training, and then our rehab team is going to certify them to return back to sports. Always when you encounter with meniscal injuries, discuss with your surgeon whether he's planning for a repair or whether he's planning for a removal or trimming of the meniscus, and always take a proper decision. Meniscal repairs are important because it preserves the knee function, and a healed meniscus is as good as a normal meniscus, and then patient can get back to sporting activities over 6 to 9 months time.